My next guest is fighting day by day to make sure that that doesn't continue. Joining me now is Dr. Ayla Stanford, a pediatric and general surgeon and founder of the Black Doctors COVID-19 Consortium. So far, her nonprofit has administered more than 25,000 vaccine doses in the Philadelphia area. Ayla, good to see you again. You and I have stayed close together over the last year. First, it was an issue of getting people tested. Now it's getting people vaccines. And when we first talked about vaccine resistance, you were saying to me, look, until let's get the vaccines, all with the vaccines we can get. Let's get that out as much as we can get it. Then we'll deal with it. Let's talk about the racial breakdown of fully vaccinated Americans right now. It's still low in some communities, including the black community. So now we're at a point where we have enough vaccine. What do we do to get more people vaccinated?
So obviously, thanks for having me, Ali. I do have to mention one thing. We've actually vaccinated over 50,000 people.
Oh, wow.
Yes, we've tested over 25,000 and we are approaching 1,000 with our home vaccination. But
that's amazing.
To your question, it's all the mass vaccination sites, sort of the fear that was driving a lot, the fact that we didn't have enough vaccine initially, those days are over. So you have to be in those pockets where you know the vaccination rates are low. We know this information. We know where those zip codes are. And you have to be out there canvassing like my team was doing on Thursday. We were in K&A, which is a high opioid epidemic area where people are houseless. They're living on the streets, they're using, and we went business to business, door to door, and just asked people. We had vaccine ready in the van, and we vaccinated them. And so the idea of just having a mass site or urgent care center and people were open, so come see us, that's done.
So let's talk about one of the things that you worked really hard at doing is creating ease and access, both initially for testing and then for vaccines. There's also actual vaccine hesitancy. I was talking to the governor of Ohio a few weeks ago where they've got this lottery, and he said, look, we're not hitting actual people who are hesitant or resistant to the vaccine with these lotteries. We're getting those people who are like, all right, fine, I wasn't going to get it. I thought this was going away. Now I better get it. How does that break down in the community that you're working in? People who will take the vaccine if you do what you just said versus people who are actually resistant to the idea of being vaccinated?
So for the folks who are resistant, you still have to meet them one-on-one. There's no magic solution. There's no mass ad campaign. The best champions we have are their friends and family that are saying, listen, I got vaccinated. It wasn't bad. I was okay. And I feel safer. For other people now who are enjoying not wearing a mask, you're enjoying that because the majority of us have been vaccinated. And also reminding them that the children that are 11 years old and under, the immunocompromised, the transplant patients that got vaccinated, but we know that it's not going to be as efficacious for them, those folks are still vulnerable. And we're going to have two Americas, those who are thriving and able to enjoy freedoms and those who are back in the hospital and sick. And so it's in the community. I heard the White House is going to put out these surge teams in these 1,000 counties across the United States where the rates are low and the uptick is starting to happen. And that's what it is. It's partnering with local and community agencies that have been on the ground doing it and allow them to be your messenger, because everyone's educated. They know you can't preach to the choir at this point. They know. So it has to change, and it's more time consuming, actually, but necessary if we want to continue the freedoms we have right now into the fall.
Ayla, thanks again for joining us. Thanks for everything that you're doing. You've been recognized in a number of places, by the way. You are a recipient of the George H.W. Bush Points of Light Award for your commitment to the most vulnerable in Philadelphia. And this weekend, you and the Black Doctors Consortium, Philly COVID-19 Consortium, will be recognized with the annual Philadelphia Magis Award, which will be presented at Independence Hall. Congratulations to you, your colleagues, many of whom I've come to know, for all that you've done. Dr. Ayla Stanford.